presentation is primarily geared towards people who may be aging into Medicare anywhere from next week to the next 2 years, and perhaps you're trying to come to some understanding about when you retire and how this program is going to fit into your life. So we call it the Get to Know Medicare. We have other presentations for people who perhaps have been on Medicare for years and want some guidance about how they might navigate forward among the many choices that are available during the annual election period, which happens every year between October 15th and December 7th. But we'll cover the top 10 Medicare questions. What is Medicare? Who can get Medicare? Do I need Medicare if I plan to work past 65? That's a big one for a lot of people. What does Medicare cover? Where can I get more coverage? What does Medicare cost? How do I choose Medicare coverage? When can I enroll? When can I change my coverage? And how do we save money? So first, what is Medicare? Medicare is a federal health insurance program for eligible U.S. citizens and legal residents, funded in part by the taxes you pay while you're working. And it is an individual health plan. So while you may be married, unlike a group plan that might be a family plan, Medicare is always an individual plan for each eligible person in the household. Medicare is not free. It's not a family health plan. It's not Social Security, and it's not Medicaid. What is Medicaid? I'm not going to spend a lot of time on this because the fact that you're working with Brophy Wealth Management would indicate that probably you came to them fairly successful, and hopefully, as usually the case, you're even more successful now with your partnership at Brophy Wealth Management. So you're not probably likely to qualify for Medicaid, but we always have people in the room that perhaps have children or a parent that does qualify for Medicaid, so we cover it quickly. A state government program, this is what Medicaid is, that helps pay healthcare costs for individuals and families and children with limited income and resources. Programs vary from state to state, but do follow federal guidelines for benefits. Eligibility varies from state to state, but if you do qualify, that's known as dual eligibility, where you have both Medicare and Medicaid working alongside each other. Actually, it's a wrap type of relationship. So who can get Medicare? U.S. citizens and legal residents. Legal residents must live in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. You must also meet one of the following requirements. You must be 65 years or older, younger than 65 with a qualifying disability, or you have immediate access to Medicare if ever you're diagnosed with end-stage renal disease or ALS, also known as Lou Gehrig's disease. So can you have both Medicare and Medicaid? The answer is yes. Some people are eligible for both, called dual eligibility. Medicare and Medicaid can work together for healthcare costs. And we have programs for those who are dual eligible that complement original Medicare and Medicaid and actually add a number of additional services. So if you know of somebody or somebody in your family is just riding an original Medicare, there are a number of programs that enhance Medicare and Medicaid and offer additional services like dental, vision, hearing, transportation to and from doctor visits, a lot of other benefits, which we can come alongside and assist them with. So the next question is, do I need Medicare if I plan to work past 65? This is something that is probably one of the biggest topics that I cover with people, and I invite you, if you're going to be what we would call a working aged, meaning somebody that is going to continue to work beyond age 65, perhaps you love your profession and your career, and you want to continue on, and your question is then becomes, should I move to Medicare at age 65 even while continuing working? Our commitment to each client is that we're going to give you the right answer, even if we don't sell you a product. So we will help you evaluate what it looks like to continue under perhaps a group plan through an employer, or if you own a business, should you continue on under your own group plan? And there are many, many moving parts that, come into play as to whether you should stay or go. What we invite you to do is, if you're not certain or you'd like to understand the various pathways that are before you when you continue to work, we will evaluate an existing plan. We will evaluate costs for Medicare, compare and contrast those, and make a recommendation about whether you should move to Medicare or not. And often I tell people, more often than not, they're better off staying on their group plan. But there are situations where it calls to move, even if you're going to continue working. And most people just feel appreciative that they're making a decision that they can stand on, and that we support professionally, rather than guessing about which way is best. The example I often use with signing up for Medicare, I had an 85-year-old man who was married to a 64-year-old woman. He stayed on her group plan. She was a school teacher. He signed up for Part B, which cost $174.70 a month, because naturally he was eligible for Medicare 20 years ago. He came to me at 85, had paid over $35,000 in Part B premiums unnecessarily, because his wife's plan was primary, and he did not need to enroll in Part B. Furthermore, he lost his open enrollment because that only lasts for 6 months after you sign up for Part B. So there are serious ramifications around this age 65 navigation point. That's just a horrific example and a waste of resources that I share as a cautionary tale. So your Medicare enrollment options when working past 65 may be different. Just know that you may be able to delay, or you may have to enroll at age 65. It really comes down to, generally you can delay Medicare past 65 without penalty if you're working for an employer that has more than 20 employees. In other words, COBRA compliant. The employer health coverage is considered creditable, and that's something we help you evaluate. The next thing is if you work for a small firm, say you are self-employed, or you're working for a law firm or a dental office or something under 20 employees, you do need to enroll at age 65 if your employer has fewer than 20 employees, or your coverage is not considered creditable. But you can always call us and we can help you scrub that at the the moment in time that you need it. So Medicare and your employer insurance can work together. If you take any part of Medicare while you're still working, you will not be able to contribute to an HSA plan. So that's one of the little, if you don't know what you don't know, and they call back all that HSA money because you signed up, for example, for Part A. And you really shouldn't sign up for A or B if you're funding an HSA and you're a working agent. Medicare will not cover anyone but you, so consider how dependents will be covered. That's where we might turn our attention to COBRA to bridge a gap if you leave and have a spouse behind. Or we may look at the marketplace and an individual plan to see if we can bridge the gap that way. But often when you leave a group plan for Medicare, your dependents are left stranded a little bit. So we will have a discussion that helps you navigate that. What does Medicare cover? Original Medicare, which is Part A and B, covers Part A is hospital service. It involves an overnight stay in the hospital. Part B is everything that Medicare covers that may happen at a hospital, but you're not necessarily overnight. Together, these two comprise what is known as, original Medicare. So Part A covers hospital stays and inpatient care, including your hospital room and meals, care in special units like intensive care. It covers the prescription drugs and medical supplies used during an inpatient stay, labs, x-rays, medical equipment as an inpatient, operating room, recovery room services, skilled nursing services, some blood transfusions, hospice care, including medications to manage symptoms and pain, part-time skilled care for homebound after a qualified inpatient stay of at least 3 days, rehabilitation services after a qualified inpatient stay. So Part A, premium free as long as you worked for 10 years or 40 quarters. You cannot be denied coverage. Coverage is nationwide, including any qualified hospital in the US. Coverage and costs are per benefit period. That's unique to Medicare. A benefit period begins on the first day you enter a hospital as an inpatient and ends after you've been out of a hospital or any skilled care facility for 60 days in a row. So unlike group health insurance or individual plans that have calendar year deductibles and max out-of-pockets, original Medicare A operating on benefit periods, based on the 60-day, transition from the hospital, could potentially mean you ring the bell several times in a year. You could have a stroke in January, have a car wreck in June, have a shoulder surgery in September, and trigger a deductible for each of those benefit periods. Must be admitted as an inpatient, not on observation basis. And Part A hospital does provide 60 lifetime reserve days after you use your first 90 days under Part A in a hospital. My mouse is acting up, sorry. Part B covers doctor visits and outpatient care, including when you're in the hospital, an annual wellness visit, and preventive services like flu shots, clinical lab services like blood and urine tests, x-rays, MRIs, CAT scans, EKGs, and some other diagnostic services. Some health programs like smoking cessation, obesity counseling, physical therapy, occupational therapy, and speech therapy are all included in Part B. Diabetic screening, education, and certain supplies under durable medical equipment. Mental health care, durable medical equipment like walkers, canes, sleep apnea machines, beds. Ambulatory surgical center services like Bedford Ambulatory Surgical Center, BASC, I think they call it. Ambulance and emergency room services, telehealth visits. Telehealth visits are not for use in emergencies, of course. That's their disclaimer so that you don't sue them, I guess. As long as you can find your way out of a phone booth without written directions, I think you'll be okay. You won't make that mistake. Fast facts, Part B premium, Part B medical insurance. There is a monthly premium. For most people, it's going to be $174.70 for Part B. Part A, there is no charge. You cannot be denied coverage. Coverage is nationwide, including any provider, just like Part A. There is a premium penalty for late enrollment unless you qualify for a special enrollment period. And of course, if you're a working agent on a creditable plan through an employer, you're covered by that special enrollment period and penalties are waived. Medicare doesn't cover everything. Original Medicare, Parts A and B, does not cover all of the cost of your care. You have out-of-pocket costs with no limit under Part B. Prescription drugs are not covered under original Medicare. Routine dental, vision, and hearing are not covered under original Medicare. Eyeglasses, contacts, hearing aids, long-term or custodial care is not covered under Medicare. Those involve losses of activities of daily living, like bathing, toileting, dressing, eating, transferring, continence, those types of things are not covered by Medicare. Excess charges for services by doctors who don't accept Medicare assignment. We call that balance billing. Care received outside the US except for certain circumstances. So where can I get more coverage? They're really, gosh, my mouse is kind of acting up. I apologize. Everything that you see on TV, everything that you see online, everything that's in your mailbox, and depending on how close you are to Medicare, you know what I'm talking about. Your mailbox is filling up with solicitation. It seems like there's 100 different paths to go down in the midst of all of that information overload. I'm here to tell you that everything distills down to two paths. Option one is you can enhance original Medicare A and B by adding a Part D prescription plan as a standalone. We can assist you with that. And you can backfill the gaps in original Medicare, and there are many, with a Medigap policy. Those are standardized plans that are available through private insurance companies, and this is where we come in and come alongside and assist you and guide you in finding value among all of the carriers and products that are out there. The second path you could choose is a Medicare Advantage, also known as Part C. These plans combine Part A and B and often include Part D prescription built right in. The best thing comparison I could give you is an Advantage plan probably most closely aligns with what you have through an employer group. It's either an HMO or a PPO, and the prescriptions are built in, and sometimes there are some additional services like dental, vision, and hearing built in, much like the HMOs and PPOs that group plans incorporate into their outlines of coverage. So it's either the supplement path with a standalone Part D prescription, or kind of a bundled package called a Medicare Advantage. These are private carriers that offer products that look, I would say, most like what you might have through a group plan at an employer group. Gosh, this mouse is so sensitive. It's somebody pushed the button on my indexing on my mouse, so it kept rolling. I fixed it. I think we'll be able to do away with that problem. So Part C, Medicare Advantage, we'll hit the highlights on that. Another way to get your Medicare benefits. It's an alternative to original Medicare Parts A and B, though they do require that you purchase Part B and maintain A and B in order to be on a Part C. Plan members are still in the Medicare program. Benefits are administered by the plan. Benefits are offered by private insurance companies. Most plans offer built-in prescription coverage, and plans may also offer additional health benefits. I call them the bells and whistles of Advantage plans: dental, vision, hearing, gym membership reimbursements, and over-the-counter medicines, and a number of other little whiz-bang services that get built into those Advantage plans. All Medicare Advantage plans cover all services that you would have otherwise been entitled to under Part A and B of original Medicare. That's by contract. Most Medicare Advantage plans cover prescription drugs. Medicare Advantage plans may also offer additional benefits and features such as dental exams, cleanings, and x-rays, eye exams, eyeglasses, contacts, hearing tests and hearing aids, fitness programs, and memberships. Again, we've covered this. They're coordinated care plans, HMOs, PPOs. There are some special needs plans in some states, private fee-for-service plans. Primarily in New Hampshire, we have a choice between an HMO or a PPO. Fast facts about Medicare Advantage. You must be enrolled in both Medicare A and B. You can't be denied coverage. You may be required to use a provider and pharmacy network. Coverage and costs vary by plan and may change each year. It does put a cap on original Medicare, which does not have a maximum out of pocket. So the Advantage plan does put a max out of pocket on original Medicare A and B, and they may charge a monthly premium, although we do have plans in New Hampshire that start at zero cost. Must continue to pay Part B premium to Medicare. Part D prescription coverage, there are two ways to get it. You can get a standalone plan that would work alongside perhaps a Medicare supplement plan, or you can have it embedded in a Medicare Advantage plan. Medicare Part D plans cover types of drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards. Specific brand name drugs and generic drugs are included in the drug list, also known as a formulary. Commercially available vaccines are not covered by Part B, rather by Part D. So things like a COVID shot or what's the it escapes me, the herpetic attack that you get on your skin. What is that? It's right, it went right out of my head, but it's a common vaccine that we're getting that fights with shingles. That's what it is. It's a derivative of the chicken pox we used to get as kids. Mm-hmm. So much like the group plans that are out there, there are tiers of drugs. Tier 1 being the least expensive, Tier 5 being the most expensive. And the structure is designed to steer you towards the best value that may treat your particular condition. During the year, you may go through different drug stages. There are 4 stages to every Part D plan, whether it's built into a standalone or an Advantage plan. And the stages are, stage 1 is the annual deductible. The ceiling on that per CMS, which is Centers for Medicare Service Guidelines, is $540 in 2024. Initial coverage is stage 2. That typically you're going to pay a copay as the retail value of your medications are accruing over 12 months. Stage 3, you may know somebody that's complaining they're in the donut hole or the coverage gap. This is where you're going to pay a percentage of your drugs until you reach $8,000 out of pocket. And then stage 4 is catastrophic coverage, and that means you would have no charge for any of your medications once you've gone through the first 3 stages. Whet your appetite for 2025. It's all I'm going to tell you about today, but this gap by legislation is dropping to $2,000 in 2025. So amount paid for prescriptions depends on stage. Dollar limits can change each year. Not all plans have a deductible. Some people never reach the coverage gap or donut hole. In fact, 87% don't. The coverage stage cycle starts over at the beginning of each plan year. One of the services that we provide, our relationship with our clients is ongoing beyond just helping you figure out year 1. Each year we'll reach out to you, invite you to the table to discuss. And one of the big topics of discussion is Part D prescription, because your meds change, formularies change, plans change. It's the most volatile part of your program. And we like to help you evaluate whether what you have this year is where you should be for next year. So Part D, fast facts: must be enrolled in A and B, must be required to use a pharmacy, or may be required to use a pharmacy network. Coverage and costs vary by plan It may change each year. We help you evaluate that. We'll superimpose your meds over all 20 plans in New Hampshire and make a recommendation if you want to have that discussion. Part D, premium penalty for late enrollment unless you qualify for a special enrollment period. Medicare supplement insurance plans. These are plans that are standardized. They're labeled A to N. And contractually, the most popular plan, by the way, is a Plan G. A Plan G is identical contractually, whether you buy it from Blue Cross, Aetna, Harvard Pilgrim, Transamerica, or any of the other 23 carriers in New Hampshire that offer gap plans, Medigap plans. They are standardized, contractually identical. So part of the job we do is scrub the market for you and find the value stories that emerge among A-rated or better carriers and make a recommendation if this is the path that you choose. Plans with the same letter offer the same basic coverage nationwide. That's pretty much what I just said. They do point out that Massachusetts, Minnesota, and Wisconsin do things differently. I call them special snowflakes. If anybody here is from Massachusetts, it would be probably especially important for us to talk because there are significant rules that apply to you that are, quite frankly, advantageous and will drive a decision that we would recommend to someone in Massachusetts versus what we might recommend to somebody in New Hampshire. So plans may help pay for Part A hospital, Part A skilled nursing care, Part B coinsurance and co-pays, cost of blood transfusions. Each plan adds an additional 365 days of inpatient overnight care in a hospital to the standard Part A limit of 90 days with the 60 lifetime reserve days, bringing you to 150. So when you bring a supplement to bear against original Medicare, it effectively assures you 18 months of inpatient hospital care. Hospice care is covered. Part B deductible is $240 under 2024 guidelines. Foreign travel is also included in many of the supplement plans. Provider charges above Medicare approved amounts. There is coverage available for that, actually only under a Plan G, which is why Plan G is one of the more popular. If a doctor's balance billing above Medicare approved amounts, the G will pay it. Plans do not help cover prescription drugs. That's why you need a standalone prescription. And a lot of the bells and whistles we talk about, routine dental vision, eyeglasses and contacts, hearing aids, and custodial care. That's what you and I think of as nursing home care or long-term care, is not covered by original Medicare. And it's interesting to note that the supplements all by contract cover whatever original Medicare covers. So we never have to wonder, will my supplement cover it if original Medicare doesn't? Original Medicare says, no, we don't cover it. The supplement doesn't cover it. But if original Medicare covers it, by contract, a supplement will supplement it. I'm not going to go through every line item of these plans here. It takes a long time, and I'm going to leave you to view them for yourself. I did mention to you the Plan G is the most comprehensive and the most popular because it covers Part B excess charges. Effectively, you could have 2 hips replaced, fight cancer all year long, see urologists every other week, and the most you'd pay for all your covered services in 2024 on a G plan is $240. So Medicare, Medigap, fast facts must be enrolled in A and B as you would with all the other programs. The foundation is Part A and B. There is no medical underwriting in New Hampshire up to 6 months after enrolling in Part B or at age 65. Nationwide coverage, it's any doctor, any hospital, anywhere in the country that accepts Medicare will accept your supplements. Or if you're a snowbird and you want to know you can see your doctor in Naples, as well as you see your doctor in Boston. A supplement can achieve that. You can also achieve that through a PPO on the Advantage side of the equation if you like that strategy. Plan premiums may vary for same coverage. Plans with more coverage generally have higher premiums. Must continue to pay Part B premium to Medicare. Just to give you a sense, if you're in Massachusetts, the equivalent, they call it a Supplement 1A. It's most closely aligned with a Plan G in the rest of the country. Is about $200 if you're age 65. In New Hampshire, you're going to be, depending on whether you're male or female, at age 65, you're looking at $155 to $170 for a Plan G, female being a little less expensive. And I just covered what Medicare costs. So we talked about the fixed amount that you pay for coverage monthly. That's Part B. You'd have a deductible and then co-insurance if you don't have a supplement or an Advantage plan. You could pay a deductible, which is a set amount that you would pay first before coverage begins. You have copays sometimes when you see a doctor. It might be a $40 copay, $20 copay. And co-insurance is defined as a sharing of costs between you and the insurance company. So if the plan says you have a 20% co-insurance, that means that if you have $5,000 in services done at 80-20, you're going to pay 20% of 5,000 or 1,000, and the carrier will pay 4,000. Part C, Part D, and Medigap costs. Plans will vary in costs they choose to include and how much. So Medicare Advantage, you have premiums starting at zero cost. They typically have no deductible, although some have a small deductible, and then you have some co-insurance with a max out of pocket. Part D prescription we covered, the 4 stages, and Medicare supplements, monthly premium plus the deductible under Part B is $240. Some plans have copays, but the ones that do, we don't see a lot of people migrating to them. Medicare
for the Medicare Advantage Part C, are those premiums calculated based on income? Is that how you would receive a zero, or is that just there's a different offering for what the plan covers, and the more coverage, the higher the premium?
That's a great question, James. It is not driven by income. It's actually a zero cost plan, whether you're Warren Buffett or any other lesser financially equipped individual. A lot of people ask, based on the theory that there ain't no such thing as a free lunch, how are they going to care for me with a zero cost premium? And the answer is that these carriers have a contract with the federal government. So when you assign United Healthcare, AARP, for example, or Aetna, as your carrier of choice in an Advantage environment, then that carrier receives a stipend, probably somewhere between $550 to $800 a month to manage your care. And it's a function of what kind of health conditions you got going on. And often those carriers will do what's called a health risk assessment, and that's what determines what they get reimbursed by Medicare. Remember, we've all paid into Medicare through working, so the government has resources set aside for these types of choices, and the funding exists.
Great, thank you.
So how do I choose? I hate this chart. It's not very clear. With your permission, I'm going to blow by it and just talk about. I'll talk about this, but effectively, we talked about the 2 paths. You could enroll in Original Medicare. Step 2, decide if you need additional coverage. Most people feel they do because Original Medicare does not have a max out of pocket. In other words, Part B has you paying 20% of all services. If you have $200,000 worth of services under Part B in a calendar year, and by the way, an example, injectable drugs like chemotherapy fall under Part B, you could be paying $40,000 out of pocket. There's no ceiling on original Medicare. So most people do not simply enroll in original Medicare. They move on to step 2 and decide the 2 paths we talked about, either a standalone Part D with a supplement, or they look at a Medicare Advantage plan, also known as a Part C. And we've covered all of what they do, so I'm not going to beat that to death. Considerations. I'm going to distill down a lot of this into a little bit of the world according to Ken, and just say to you, this, by the way, all of this is going to go to you if you provide your email address to James. Anybody that wants a copy of this so that you can revisit this. I know this is, speed seminar 101 here. But people often ask me, which way should I go, Ken? Basically, what does the mechanic drive? We all want to know what our mechanic drives, right? And people ask me, which way would you go? Which way should I go? We have about half of our clients going Advantage, half of our clients going supplements. And we claim that nobody makes a mistake. When you call our office, we're going to schedule an hour and a half to go through specific carriers and plans and talk about your specific circumstances in terms of your risk tolerance, your comfort with risk, your resources if something went south, your ability to pay the premium, your ability to pay cost shares out of pocket. And we also really explore, I tell people, this isn't a financial decision alone. It's an emotional decision. And I always joke that there are people on Medicaid that don't have 2 nickels to rub together that, would shrug at $100,000 bill and say, oh, well, I'll just pay them $10 a month for the rest of my life. And I have multimillionaires that cry like babies when they have to write a check for $300. And so clearly it's not about the finances or the resources. It's about the emotional connection to your situation and how you respond. And there's no wrong way to respond, with feelings. How you feel is how you feel. So what we try to explore with you is what brings you the most comfort. Would you rather pay a higher premium and know that there's a modest, exposure? Or are you feeling like, I eat right, exercise, jog every day. My father lives to be 150, and I'd really love to have some dental, vision, and hearing thrown in, and I could afford to pay, the max out of pocket on a plan at $7,500 a year for the next 20 years without crying. That the way you answer that question, both financially and emotionally, is what helps us to guide you towards what's going to be a good fit. We also evaluate access. Are you going to jump in a camper and drive all over the country? You want to know you can get care in every little village, including the one with 20 people in Montana? Or are you never going to leave Bedford? That plays a role. Access is always a big part of the decision. So that's kind of at a high level the types of discussions that we have with clients in advising them about what path might be best. The first thing we do, though, is educate you. We don't like to tell you what to do. We want you to understand what a zero-cost plan looks like. We don't want you to be surprised at a cocktail party. You're paying $200 a month for a supplement and another premium for a Part D, and your friend says, I've got this really great zero-cost plan. And you wonder, why didn't Dublin Health tell me about that? We're going to talk about all the options and the pluses and minuses of each path in hopes that you will come to your own conclusions about what best fits your lifestyle and your comfort levels emotionally and financially.
And Ken, let me jump in
Yep.
for a moment there too, because one thing I've done with you and some of my clients is we'll get 2 scenarios, and okay, this premium, you're paying a higher amount, but this is it. This is what you're paying. We know you're out of pocket caps, all that stuff, and I'll put that into a financial plan, or we'll put one in. Here's your low premium, but you could be out of pocket $10,000 a year in medical expenses. And
well, the ceiling, just to correct you, the ceiling per federal guidelines doesn't allow for an exposure beyond 7550 in 2024, but your point is taken.
Yeah, correct. So we'll build that into a plan and then be able to look at, okay, do they both work? And For most clients, it does. Okay, now that here's the emotional side. We know the mathematical side works either way. Emotionally, what are you more comfortable with? And just as you said, I have some people that say, I'll take the risk. I don't want to pay a dime more than I need to. And others say, I'll pay more to know there's no surprises. But that's something that we've built out, and you guys will provide us typically the two scenarios we can then put into the plan and discuss.
Well, you frame it beautifully. That's exactly what we do. And you and I know that we collaborate as you try to build a strategy that goes way beyond this piece of the puzzle into the bigger picture. And yes, that's exactly what we do. So the initial enrollment period for everybody is when you turn 65. And this period starts the 3 months prior to the month you turn 65. It includes the month you turn 65, and it permits enrollment even after age 65 up to 3 months. So it's a 7-month window called an initial enrollment period. That we recommend you enroll early because Social Security is busy. We have 10,000 people a day aging into Medicare in this country every day. And then the Advantage plan, you need to enroll directly with the carrier. And I would elaborate to say, you enroll with us if you're working with our agency. As an aside, we don't charge a fee for our services. We're happy to educate people all over the state and New England. And we just respectfully ask that if you like our style and appreciate our service, that if you would work with us and place the business through us, the carrier compensates us on a commission basis. So we don't add anything to the equation. We don't add anything to the rate that's posted at the New Hampshire insurance website. We don't add any fees. For those who miss their initial enrollment period, you may enroll in Part A and B or both. You may choose to enroll in a Medicare Advantage plan or prescription drug plan, and a late enrollment premium penalty may apply. Of course, we said that's waived if you go beyond that age, but you're on a creditable plan through an employer that's over 20 employees. Medicare supplement open enrollment is 6 months. For those in Massachusetts, you actually have the ability to come and go from a supplement to an Advantage plan. It's much more liberal down there in terms of access. But the significance of this 6-month window is after 6 months, you must qualify medically. So if you have some medical issues, you want to just go into it with your eyes open that you may not always have a supplement available at your fingertips, except in the first 6 months of eligibility, which could be at 65 or older if you are beginning Part B for the first time as a working agent, going into retirement. Special enrollment period, working past 65, I just talked about that. You actually get 8 months if you're a working agent. The cautionary tale here, you want to call us immediately, because even though 8 months is the window to have a special enrollment period, the Advantage Plan special election period is only 60 days. So you cut all of those opportunities out of the equation, at least till the next annual election period. If you're coming out as a working agent, you want to be talking about this practically immediately if you're retiring, or even before you retire. But technically you have 8 months coming off of a qualified group plan. For those, let's see, I think that pretty well covers that piece of it. There are penalties if you're not on a plan, a creditable plan. It's 10% for every 12 months. You're not on Part A. Unless you're on a creditable plan, it's a 10% penalty again for each 12-month period that you delay Part B, unless you're on a, these are all waived if you're on a creditable plan. And Medicare Part D, none if less than 63 days without creditable coverage. But if you go beyond that, they charge you 1% per month of the average Part D premium for the rest of your life. So if you said, I don't take meds, I'm bulletproof, you don't buy a plan, 10 years later, you need meds, you buy a plan, you're gonna pay 120% of the average cost of a Part D, which is about $33 a month, and you'll pay that for life as a penalty. We could get Part D plans, as low in 2024, as low as 50 cents a month, but typically under $10 a month. So it doesn't typically make sense to not get a Part D, even if you're not taking meds. You still want to mitigate that risk. Annual election period, we talked about October 15th to December 7th to make changes. That does not include a supplement, only Advantage and Part D prescription, because after 6 months, a supplement is medically underwritten. A lot of people don't know about the open enrollment period. This is January 1st to March 31st. This is available to anybody on a Medicare Advantage plan. They can switch to a different Advantage plan. So if you choose one in the annual election period and you hate it, we can off-board you over to another carrier. Or you could go back to original Medicare and buy a standalone prescription drug during this period of time. It's called the open enrollment period. And then there are special qualifying events if you move, or you're a leaving retiree, or leaving a union, or COBRA coverage. One thing that's really important to note is COBRA coverage is not counted as creditable, even though it may be a mirror image of the coverage you had as a working agent. Do not use COBRA as a bridge to, buy more time and figure it out. You can leave yourself stranded, because if, 18 months after COBRA, it's June, there is no special election period in June, no annual election period in June. So just know that about COBRA. These are, pretty self-explanatory. Use your preventive services to help save money. Use your provider network. In-network is typically a better deal than out-of-network. Ask about generic drugs. Use plans' preferred pharmacies. Most plans have named 2 or 3 preferred pharmacies where their copays are lower if you'll work with them. You can go outside of that network, but you'll pay higher copays. And understand your status in the hospital, whether you're in there for observation or whether you're an inpatient, because there are things tied to that. We talked about extra help. Most of you are not going to qualify for that, but there is information on how to apply for extra help if you need it. And there's probably some ways to get a hold of United Healthcare. We so appreciate if you call Dublin Health and Benefit, because United Healthcare, you're going to get a phone worker that might have been there 10 years or started last Thursday, and they only represent United Healthcare. If you call our office, you'll have access to all the products that are available in New Hampshire. So with that, I'll take any questions you have, James.
Excellent. Yeah, I think you answered quite a few of the ones that we had either come through the chat or that I received privately. One I don't think you had covered is really just paying for it. So, how do they charge both if someone has, they're 65 and they've turned on Social Security, or if they've started Medicare, but they're waiting to turn on Social Security until, 70 or a later point?
Yeah, understood. So supplements always need to be set up on an auto draft through a checking. Advantage plans and Part D prescriptions can be authorized to be paid out of a Social Security retirement check. If you're not retiring, or getting a retiree check, they'll bill you quarterly. And I think they also offer an automated payment method for Part B. One other thing it's important to note is that there is an income-related monthly adjustment amount for Part B. I talked about $174.70. That is for any couple earning less than modified adjusted gross income of less than $206,000, or an individual less than $103,000. That encompasses most people, but I know you have a lot of high income earners by the nature of your business. Just know that you could pay upwards of $559, and it is a sliding scale from $174.70 to $559, depending on where you fall on the continuum, above 206 all the way to about $750,000, and anything over that, you pay the $559. But you'll pay a slightly higher increment for your Part B if you're at 300,000 instead of 201 as a couple.
And if someone triggers that, how long are they paying that for? Is that for 1 year, 2 years? How long are they paying that higher premium amount?
Well, I hope it's forever, because that means you're rich forever. But the reality is, and it's a great question, because what Medicare does is they look back 2 years. So if you were retiring in 2024, they're going to look at your 22 modified adjusted gross income. That's your adjusted gross income plus your Social Security that may not be income taxable, or other forms of non-taxable income that get counted towards MAGI, or modified adjusted gross income. Things like municipal bonds that might be tax-free, but they're income. So all of that income is calculated. They look back 2 years. Every year they look back 2 years. So if you had a big year, you sold a business for $2 million in 22, you might get clobbered for a year. Then in 23, you're back to a normal income, and maybe you're at 100.5 as a couple. That 559 would drop back to the 174. It gets reassessed automatically by Social Security every year, with a look back of 2 years. Furthermore, there's a form, and this is some of what we coach people through, is there are exceptions if you've retired, or you've divorced or married or lost a spouse. There are exceptions that can be submitted on an SSA 44 form, notice of change, and there are qualifying events that would absolve you and reduce that IRMA.
Yes, yeah, I've worked with a few clients in situations like that, where it was a unanticipated one-off payment that made their premiums jump to an unaffordable level, or at least something they didn't want to pay.
Yeah, but like, who does, right?
Correct. So I think that covers generally the questions that have come in. I had a few more, but you've gone through them throughout the presentation. The one thing I do always like to coach people on, and you mentioned it, you set aside an hour and a half for these conversations. Is the issue is it's different for everyone. What are the prescriptions you're taking? Who are your doctors? Are you traveling? What's your income? Are you married? It's different for everyone. So I would always encourage people, again, reach out to our office. You'll have the contact information for Dublin with any questions, and we can work together to make sure that you are getting the best possible option for yourself. Not, we like to joke and call it the brother-in-law conversation. My brother-in-law is paying less than me. Should I be doing that? And it's like, well, you and your brother-in-law are two different people, and we want to make sure you're getting what's best for you. So this presentation will be available, but I also encourage people, just reach out. As Ken said, they are compensated through Medicare, not through a cost to you. So it's something where it's worth, and we've been paying in every paycheck you've been paying in, so it's worth having conversation and making sure you're optimizing your personal situation.